All right, we're going to be talking about the box squat and why I think it's going to be one of these exercises that everybody should be doing who are experiencing pain and dysfunction and all that other sticky stuff. So, what is the point of a box squat? Regularly, when you go to do a squat, body weight, barbell, front squat, any sort of squat, come down, boom, you hit here. A lot of people, depending on how they're built, their hip torsion, knee angles, stuff like that, Q angles, they can get stress through their hips, through their knees, through their low back, sometimes even a little bit of mid back. So the point of a box squat is it creates this disassociation. When you come down, you get kind of a break. Your ligaments and your nervous system kind of get this sensed breather at the bottom of the squat, which is where some people might get issues. Some people even get issues at the top. But for having any kind of pain at the bottom of the squat or throughout the range of motion of the squat, box squat of different sizes is going to be key. So if somebody's having knee pain, box squat, what it can do, it gives that cue to sit the hips back, and you can keep coming back, create this posteriorly dominated hip squat essentially. But the point is, a lot of people get wrong when they come back, they're going into sofa mode. It's what I call sofa mode when they rock, come forward. Now, if you're having pain, severe pain initially, and this is just not the answer for you in terms of keeping tight, you can maybe do the sofa squat. Some people argue it creates that shear force in the lumbar spine. Again, it depends on your personal preference of injury in terms of what you're dealing with, but I don't like the sofa squat. It teaches not the best mechanics in terms of how to stay tight during a movement. You don't want to rock, right? So when you go down, send the hips back, and then you can sink through the knees, pause. I'm keeping tight in my midsection, in my trunk, and then I'm keeping my head and chest up. I'm looking at myself in the mirror or at one spot in the wall, and then I can come back up. So variations or application of variations, for what you need when you're having knee pain, hip pain, back pain. First cue is going to be if you're having back pain. Doesn't necessarily matter what your knees and hips are doing. Box squat, it might be beneficial in general, and you can play with the technique. So you can be right up on the box and have the box actually higher. See how this box is higher than this one? Have a higher box if someone's having back pain, especially at the bottom of the squat. So when they come down, one, it gives them that disassociation. Two, it keeps them out of the range of motion that is causing their pain or dysfunction. Three, you're still able to train a squat pattern. I think everybody should be able to squat. It's not 100% necessary, you can argue, to put in someone's programming to not squat. Again, it's up to the person, their goals, the whole nine. So, sorry about the tangent, but back into box squat for back pain. Keep them out of that range of motion. So if you have a box like this, and I'm pretty short, so this would be really high for me. My knee is much lower than my hip, or my hip is much higher than my knee. So theoretically, I'm not getting into that range of motion that would be causing low back discomfort. Boom. For that having hip pain, same variation. A lot of people, they get this pinching deep in their hip. A lot of people, when they go down, they create more hip flexion, creates another moment arm, and this is pretty deep in the pocket, and it sends that femur back in the acetabulum. It's that pinching. It's not necessarily causing damage. It just could be a sensation issue, but we want to keep them out of this extreme hip flexion. So what you can do, high box squat, but what I recommend doing is turning this guy this way. That way they can kind of have a hip shin, hip scaption. It's kind of the same line as a scaption of the shoulder, a better plane for the hips. Go a little bit wider. You can turn your toes out. And this is just for the box squat. This is not talking about any of the other modifications you can make to a regular squat. I'm just talking about the box squat. So turn the box out. That way they can be maybe a little bit closer. Have a more upright torso, and it creates more focus on the knees, on the quad, makes it more quad dominant. So they're going to be chest up. They're going to be backed up to the box. Basically, it's going to be sit back just a little bit, and then shoot the knees forward. Boom. I don't have this crazy forward trunk lean because I'm placing the load onto my quads more than my hips and my posterior chain. See how I'm going more forward knee travel, and you can just stand up. And if that's still bothersome, put a plate, a weighted plate, or a smaller box or a plyo box if that's what you got, higher, and boom, part of your rehab. Do that for a couple weeks, maybe even a week. Desensitize that range of motion, and then you can build upon that. And then you can take that plate away, and then you're creating this deeper squat. And then you can move over to a lower box. You're getting a lot more. And then if you're a power lifter, start incorporating that low bar technique, sending the hips back first, and then sinking in, and just playing around with that. Let's move on to knees now. So, same concept though. I even played into it just there. If you're having cranky knees, and you can break this down into any possible situation, the crankiest knees you can still get to squat. Just depends on context. So if I'm having pretty good knee pain, pretty severe knee pain at any part of the range of motion of the squat, again, find that sweet spot using a box. You can play with it. And I'm going to actually have my feet farther from the box. And my cue is going to be stick the hips back and then come forward with the trunk. So I'm adding more forward trunk lean. I'm keeping my knees in line with my tibia, everything else. There's no forward knee travel here. And then from here, I'm picturing spreading the floor and shooting my hips forward. Boom. Takes a lot more stress off the knees, one of the backside of the glutes, and kind of the lumbar extensors areas. So, boom, I'm sticking first. And if this is still not doing it for somebody, have them in the squat rack, of course. And they can just have a rope, a band, like this. And you can progress or regress the band tension, have that up on the rack, and then they can use this as a hand assist, and then same cues, hips back, and then they can sink back into their squat. So again, I love the box squat. It's not just a West Side thing. It's not just for power lifters. It could be for Olympic lifters. You can turn it and use it for a front squat variation, a goblet squat variation. It just depends on context and pain and goals of the client. So, and like I said, you can't just stick to a box squat. So do this for a couple months or a couple weeks until they're able to do a weight that's, RPE 8 to 9. Could be for a set of 5, set 8. I'd probably stay in the set of 5 for a little while and then get them into heavier loads. And then once that's progressed, you can move into a lower version. And it's not going to be the same weight that they were just using. But boom, here I'm hitting depth. This is powerlifting depth for me. So this would be the goal if I were having some hip, knee, low back pain. Am I going to be up close to the box? Am I going to be far away, sending my hips really far back? You can even train it into somebody that wants to be able to have a more quad dominant squat. So not even for rehab purposes, just for fitness purposes. They're so used to doing this, sending the hips back, and you can have them sit here and then just say, shoot the knees forward to keeping the chest up. Boom. They get a little bit of a break, and you hit where that ankle dorsiflexion is limiting them, if that's what's limiting them. So again, you can use a box for squats, deadlifts, not so much bench press, but box squat is definitely a key. Having a box in any gym is going to be key for rehab, especially if you're working with Olympic lifters, power lifters, CrossFitters, anybody of the sort. And you can throw it into your own programming if you're having sticky situations, if you're kind of overloading the wrong. If you're not overloading the wrong stuff, you're just kind of burnt out. You can take a turn cycle or a transition block in your programming. Just give your joints a break. Essentially, let them kind of desensitize to everything using the box squat, and you still get to train a pattern, which is awesome. So, hope this helps. Maybe I'll post more videos. Who knows? We'll see. Trying this thing out.